Doctors of Reddit, what is your most oh my god what is that moment while treating a patient? My mum is a nurse and has seen some pretty messed up things. The one story that sticks in my mind involved an elderly man who came into the hospital 3 times a week to have a growth on his face washed and redressed. The growth had slowly taken over the left hand side of his face, so much so that his left eye, his only working eye, had closed over. He was effectively blind. This meant that his wife, whom he had been looking after for years due to her frailty, was now tasked with looking after him instead. Furthermore, this bloke was old enough that the hospital didn't want to operate on him. So the hospital visits stopped. He could no longer get there, so instead a nurse would visit him 3 times a week. Now this growth was unsightly, wept constantly, and smelled bad. Really bad. The whole house stank of it. The nurses said it smelled like death and thought he was going to die any day. During one of these visits by my mum, she was cleaning his face over the sink and noticed a flap of loose skin. She went to clean it with the sponge and squelch. The growth fell off into the sink and it was crawling with maggots. The sink was now filled with dead flesh and maggots. And the smell. Oh goodness, the smell. Turns out a fly had laid some eggs on it at some point, and they'd hatched and started eating all the dead flesh in the growth until it fell off. And the man? He was fine. There was new pink skin where the growth had been, and he could see again out of his left eye. Gave him a new lease on life. Heartwarming story, yes. Most disgusting my mum has ever told me? Hell yes. This was in med school, dermatology rotation. I got to see my own patient. So I asked what the problem was. He told me he thought his genital warts were back. I asked why. He didn't say a word but turned around, dropped his pants, spread his butt cheeks, and showed me a cluster of genital warts around his anus at least 10 centimeters in diameter. Even when he stood up straight it was just sticking out of his buttocks. I put up my most professional voice to say HMM. Yes, I think you're right. The man thought this was hilarious. I'm not sure if I've not seen more surprising things after this, or have just gotten used to them. Saw/smelled what turned out to be an infected Bartholin's gland which secretes vaginal lubrication. I've witnessed childbirths, trauma surgery, and worked as a nurse's aide 4 years before medical school, and this was the only time I've almost puked in a patient's room. The smell was the most terrible thing I will probably ever be exposed to. Abgin rotations. I was delivering my first baby. It was an older lady from the rural side of town. When I asked her to push as the baby had fully crowned, a wad of worms exited her anus. I'm talking at least 60 live worms. I gagged so hard, but managed to keep a straight face throughout and deliver the baby. I realized then and there that Abgin was not for me. Paramedic here. While working in the air one night we had a guy come in complaining of groin pain. So we bring him back, and it turns out he has a master lock, the kind with a spinning dial that you use to secure your locker at school, locked around his pants. Essentially blood could flow in, but could not flow back out, so this thing was hugely swollen. He had panicked after he realized he could not remember the code, dealing with a real genius here, and he took a screwdriver to the dial and snapped it off. So we consulted with urology, and the urologist wanted to take him to surgery, cut his ween lengthwise, slide the top out then the bottom, and then suture it back. Needless to say the patient wasn't thrilled with option A. So option B was for this big ass nurse, we'll call him Tom, to go in with bolt cutters and cut it off. Option B selected. Curtain closes. Tom gives a 1, 2, 3. A loud scream. At 3 a pop noise. Tom exits with a broken lock and the man was sent to the floor to recover. That's just one of so many, but I always tell that one. I'm a surgery resident. I once helped operate on a man whose face was chewed off by a bear. I had to find little scraps of skin at the edges off the hole in the middle of his face and try to decide where they went to try and make the damage smaller. I also saw a patient come to the emergency department with a Barbie in their rectum. He apparently puts the arms up and legs down like a diving position, rubber bands the arms together, then places it in his rectum for a time. When he wants it out, he takes laxatives. Only this time it got stuck. The kicker, when we removed it, he asked for it back. There used to be a well-known patient that would present to the emergency department with frequent urinary tract infections. Now, urinary tract infections are much less common in men than in women, and don't occur sporadically that often. This gentleman was a male stripper, and his part trick would be what he called a ruby shower. In essence, he would empty his bladder and replace its contents via a catheter with red wine. He would then empty his bladder during his performances. Unfortunately, fate caught up with him. One infection became too severe and he did not survive. Open bracket. My friend's brother, who is a surgeon, told me lots of WTF stories, but my favorite is this one. More funny than gross. While a student doing residency at Anonymous Major Not RPH or Joondalup Hospital in Perth, Western Australia, a patient was admitted through the emergency department because he and his boyfriend had been playing a kind of sex game where they each stuck a balloon on a straw up their urethras and took turns to blow into the straw, which apparently gave them an OMG need to pee feeling and a fit of the giggles. But this time, said patient had laughed so hard the straw came out, leaving the partially inflated balloon behind. The docs tried a few things to pop the balloon, but couldn't quite get at it, so they decided that a quick keyhole and camera into the bladder to puncture and remove the balloon was the only option left. The keyhole went fine and the balloon was easily deflated and removed, along with many other fragments of variously colored balloon material. My buddy's bro said though maybe 10 or 12 balloons had popped in this patient previously, leaving fragments in his bladder. It wasn't the first time this boy had lost a balloon up his cock, but it was the first time it had been full of air when he lost it. Both my parents are doctors. Nothing seems to have really shocked them except for patients brought into the ER who were in motorcycle accidents. They wouldn't go into detail, but briefly said that if you're not wearing protective clothing and you get dragged across the road, it can do horrific things to your skin. And more specifically, it can do absolutely horrific things to men's nether regions. As in, what is that? What goes where? What did that used to be? And what's even worse than your penis and testes being ripped in half or ripped off is that they use what are effectively metal scours on the wounds to get the gravel out. I'm not even a boy and that makes me wince. I was working as a scribe when we went to see an 8-year-old girl that had a fever. Nothing too remarkable until we started the physical exam. We examined her head. Normal. We examined her upper extremities. Normal. Then we pulled up the blanket to examine the lower extremities. Her feet were the size of an infant's. You should have seen the look on the doctor's face as he was trying to figure out how the girl's feet got so small. The mother looked up at the doctor, saw the look of confusion on his face, and said, "Those aren't her feet." She pulled up the blanket a little further, revealing a pair of perfectly healthy feet, nestled next to the feet of a doll that she put under the blanket. We saw the doll's feet and thought they were the girl's. My dad is a nurse. I have asked him this question before, and most of stories are about people who come in with deodorant cans up their butts and try to claim that they were climbing in a windows and fell on the can or something. But there is one story which he has told me which really stands out. When my dad was in his mid-20s, he worked in the emergency department of a hospital. One day this morbidly obese lady comes in complaining of abdominal pain. They start to look her over. Everything was going fine until they decided to look in the folds of her gigantic stomach. When they smelled this horrible smell, they found a decomposed chicken wing covered in maggots which had started eating at part of her skin. Yum. My dad is a doctor, an internal medicine physician, if that means anything to anyone. He told me this story once of when a young man, late teens, came into the hospital with a question about a condition he was having. He said his pubic region was itchy and uncomfortable, so my dad asked him to remove his pants so he could try to identify the problem. Now, since the guy was African American, my dad had quite the WTF reaction when the man pulled down his pants and his pubic hair was white. It turns out the guy had gotten crabs from his lover, and the little bugs had laid microscopic eggs in his pubic hair, making it look white. The mental image still gives me the chills. Imaging tech here, so I basically look at black and white images of people's innards. Once I had a guy, and it looked like his abdomen was filled with fluid, but it looked very odd. Then I realized the fluid was moving. The guy had the biggest aortic aneurysm I've ever seen, so big I couldn't measure it on my machine. He got sent off to the hospital. I was in outpatient services that day, and I don't know what happened to him. I also had a woman with so many holes in her heart, in the muscle between the heart chambers, that it was like Swiss cheese. Another time I was in a prison scanning a con. He'd been shot and all of his abdominal muscles were removed. He wore a Velcro girdle to keep his stomach in place. I put my scanner down on his abdomen, and I had to figure out what organs he was missing, because he had some removed from after being shot, but he had no clue. I think he was missing a kidney, the gallbladder, part of the liver, and like half of his pancreas. I interned in a city that gets very cold in the winter. Homeless people who were having a tough time surviving outdoors would come to the ed to get admitted, even if just overnight. They'd get a warm bed, a few hot meals and a clean up. This one fellow was in really rough shape, couldn't walk. The poor nurses did most of the cleanup, delousing, sponge bath, dressing the open sores. My job was to do the physical exam including the mandatory rectal. Literally had to lift that scrawny flap of her butt cheek and pick the encrusted dirt / feces / matted hair away from the rectum to expose the anus. Thankfully I only had to turn 180 degrees to reach the sink that I dry heaved into. But before this fellow can be discharged he needs a podiatry consult. His black gnarled feet have thick yellow big toenails that have grown in a circle and are now piercing the bottom of the toe. The reason he can't walk, podiatrist in turn comes in, starts a foot soak, and proceeds to tackle those nails with something that can only be described as modified tin slips. Now you know how some people have that habit of opening their mouth when concentrating really hard? Yup, he clipped that nasty nail, and it flipped right into his mouth. We shared the sink. EHH. I'm not a doctor, but a couple of years ago I was talking to my dentist. She was complimenting me on my sparkly white teeth and healthy gums. I mentioned something along the lines of I could never be a dentist. I couldn't deal with those who have bad breath or rotting teeth. Then I made the mistake of asking what the worst case was for her. She told me about a time that a woman came in with pretty much all of her teeth completely rotten and an abscess on the back of her mouth. The dentist apparently started working on the back of the mouth and popped the thing. She described the smell as that of a dead animal. Apparently the smell was so bad that it permeated the thin mouth cover and the abscess had popped with such force that some of the pus landed on her shirt. I think of that story every time someone tells me I should do interpreting at hospitals. Wife is a trauma surgeon. She's sleeping now, but I get about an hour every night where she unloads the horrible shit she sees. One that sticks out is the girl and her boyfriend on the motorcycle. They were taking a sort of underground turn from one highway to the next, and he was going way too fast. He started to get close to the wall, so the girlfriend on the back decides, best idea, go ahead and put your foot up on the wall of the tunnel. Foot catches the wall, she flies off, leg breaks at the femur and the broken bottom half of her leg drives straight into her gooch. She gets a middle-aged male in for stomach pains. Says he was at a party, got drunk, woke up at another party, and hasn't been able to juice in a few days. Tox screen comes back positive for amphetamines, cocaine and weed, so a good night out. Court scan comes back with one full-size Glade air freshener can totally up this guy's ass, bottom first. It is so far up that the colon has collapsed around it at the anus and created a vacuum behind it. They try a number of ways to get it out with no luck. Finally, she gives him a paralytic because his beehole keeps fighting back, and my wife is now double-fisted up this guy's ass. There is a picture of her holding the can somewhere out there. This is the second aerosol can she has removed from the ass of someone in town. First one was a full-size spray-painted can. The man bought the can at Lowe's, placed it in the bag, and inserted it with the handles of the bag hanging out his ass, thinking he could just use the plastic bag handles to pull it out. He broke the handles trying to pull it out. The bag still had the receipt in it. Lots of dog attack stories. Recent one is 8-year-old boy attacked by 3 PBs with more than 100 puncture wounds. 7 PB attacks this week, only 1 provoked. In accordance with the Reddit circle jerk party around here, they are not the most aggressive dog. They are, however, the dog most likely to cause injury or death during an attack by a wide margin. I'd have to get her on here to really do this justice, but with her schedule, not likely.